Morning, everybody. Today is Thursday. It's about 10:05 a.m. It's July the 11th, and I am getting ready to go have surgery. So basically, I'm going to get my port placed today. It's a minor surgery, but it's very serious. It's serious, but it's minor. I don't know how to kind of explain that, but I think the method that they've came up with is what makes it minor, but it's tedious. Let's put it that way. Tedious. It's a tedious surgery. So anyway, this morning, I know this is gonna sound kind of ridiculous, but I'm going to get my nails done. But why am I going to get my nails done for surgery? Not to be trying to look fancy or cute or anything, but I have on acrylic and stuff, so I want them to kind of, you know how acrylic can be, those of you who are female and watching this. So basically, sometimes they have a hard time with the heart monitors, not the heart monitors, the pulse monitors that they put on your fingers to keep track of your pulse and your heart rate. So basically, with acrylic, sometimes that can cause a problem. So I'm going to the nail shop this morning real quick to get my nails taken care of, because my heart rate excuse me, my heart rate tends to jump very high just at rest. So I want to make sure that, you know, there's no complications with trying to monitor me. So I'm just, you know, making sure I have that done with. But really, they can be monitored through acrylic. So I'm not saying that when you have surgery you need to take off your nails. No, you just need to make sure they're the acrylic isn't on there thick, and I don't like my acrylic or gel on there thick like that anyway. So and make sure they're cut down so the actual monitor can sit on your finger in the right place. So basically that's what I'm doing. I really need to get my nails cut down so it can fit. So I'm going to the nail shop now, and I'm going to the nail shop down the street from my house. Like, it's 2 minutes away. One, because nobody's here to drive me, and two, because my hands hurt so bad I cannot clasp the wheel. I cannot clasp the wheel, so I drive like this because it hurts to make a fist, especially first thing in the morning when I wake up. It takes a little while for me to get some mobility, basically. I don't know. Yeah, this is the nail shop right here. So it takes a little while. It takes about 2 to 4 hours. I'm starting to notice that it's taken for me to loosen up, for my joints to loosen up when I first wake up in the morning. And that's a very, you know, extremely long time. And it's happening, I guess you would say, it used to just happen when I go to sleep and wake up, but now it's happening definitely when I go to sleep and wake up, even if I take a nap, even throughout the day, you know, when my hands are just at rest for a minute, and then it hurts to overwork my hands. So it's just lose. So yeah, just this quick, I'm at the nail shop, and we've only been recording for 3 minutes. So yeah, anyway, I'm not even gonna try to park straight. I'm getting ready to go in, get these nails done, and I will try to vlog the rest of my day when I get to the surgery center and all that other good stuff. Alright, see y'all later. I left the nail shop. I decided to take my nails off because of the reason I explained before. And so I just took my nails off. They're long enough. I got a very light polish, because dark polish, you know, when they use like the pulse monitors on your fingers, actually sometimes it won't pick up, or it'll stop, and that wouldn't be good in my case, especially with my heart like it is right now. So I went ahead and just, you know, make sure that I'm good on that part. So basically, it's coming down to it. We got about an hour and a half until I have to be there. Maybe not even that, maybe about an hour, I don't know. About to go home and take a shower and all that stuff. But let me tell you why I'm scared though. I'm scared because, yes, I'm going to be sedated, but it's going to be a light sedation, meaning I can probably wake up anytime. I'm not trying to wake up. You know, I'm not trying to, I don't care if I can't remember it. You know, it's kind of like a conscious sedation. I don't want to deal with that. You know, that's why I'm scared. Because, you know, I don't want to wake up in the operating room hearing the beeping, and even though I won't remember it, and hearing all the doctors, the surgeon talking, and I really don't want to hear that because I done seen too many shows. Grey's Anatomy, House, General Hospital. I done watched too much TV to be, you know, to be waking up. So that's why I'm scared. I'm gonna ask, to be honest, because I wasn't gonna do this, but I don't want to go under, like fully under, unless I have to, just because of all the craziness my body's doing. So I don't want to have to fully go under if I don't have to, which I get that, which I'm okay with, like a twilight sedation, but I just don't want to be in and out. Even though I won't remember it. I just don't want to be in and out. You know, that's uncomfortable. I might have anxiety. You know, I might get a little anxious. But I'm gonna tell them to give me something for that. I'm gonna have to, because I'm just gonna tell them I'm scared, and I'm just gonna, if they won't give me something, I'm just gonna start acting hysterical, because it's either act hysterical to give me something, or y'all really gonna have a problem and gonna have to give me something, because I'm gonna go hysterical for real if I wake up in the OR. So yeah, but anyway, I'm about to go home, so see y'all later. A lot of you are probably asking, like, why does she have to get a port? So basically, I have to get a port. I know I've talked about this in my videos before, but I'm getting ready to finally, hopefully, if everything goes right with insurance and money-wise, I will be starting Benlysta. Now, Benlysta is a medication. It's made for lupus specifically. It's the first medication for lupus besides steroids and Plaquenil and Tylenol. Just saying that, I'm thinking about it like, what the heck were y'all doing all these years? So it's the first medication made specifically for lupus in 50 years. Something's wrong about that. You know, something is definitely wrong about that. But anyway, so the Benlysta is it's in liquid form, and it's given through an IV. Some people like me can't really get IVs, meaning from having chemo therapy, for having IV chemotherapy in the past, and you know, doing a lot of blood draws in the past, and doing a lot of blood draws now, I basically have no veins. So I'm not gonna over exaggerate. No, I'm not gonna say I don't have no veins. I honestly have one vein left, and that, with the disease I have, that's not good. Any emergency situation can happen. Like, you know, I talked about how lupus can attack any organ, you know, or just any system of your body. It can happen. So having one vein to access is not a good thing at all. So I decided to get a port for those reasons. A port is pretty much a permanent. You can get it replaced when need be, or what have you. But I'm getting it for those reasons, because of my severe illness. The second reason why I'm getting a port is definitely because of the medicine. It has to be put in intravenously, and like I said, I have no veins to do that. And so a port basically is a device, probably about this size, and it's put underneath the skin in your chest, and it's connected to a catheter that goes in a deep vein all the way to your heart. So yeah, I will talk about all of that, the care and everything with that later. I had something similar. I had a PICC line. just real quick, I am at the surgery center, just got back in the pre-op area, and I am about to change into my gown and get ready. Alright, goodbye. I can walk out. But yeah, so I just got my gown, put on my clothes in here, and this is the pre-op area. Pre-op. Gowned down. Have my gown on. And so I'm just waiting for them to come and hook me up to the IVs. So they're going to start fluids if they can find a vein. That's going to be a hard part. I have one vein left. So I'm praying that they can find a vein. So I'm just waiting for my nurse to come back into the room. Then they'll get my parents. They give me some medications. And then when I get to the operating room, they are going to give me a sedative. Now, I was just informed that I am not going all the way under. It's not going to work for me. But hopefully I won't have any anxiety about this. So, yeah. So we'll see how this goes. I just got my IV put in. So I am getting IV fluids. I had to get stuck twice. And that is actually pretty good. Because I have to get stuck like 1,000 times. So that's my IV. I'm just running through the line. Yep. So yeah, we're doing pretty good. The nurse went to go get my parents to bring my parents back before the procedure, and they'll be able to stay in here until it's time for me to be wheeled back. So yeah, that's it. I'm at home. I'm hurting so bad right now. But I made it out. Ooh. So basically they tried to go in on my left side, but my veins were too bad on my left side. So they went on my right. I'll show you all later. But I have an ice pack on right now. Because it's hurting pretty bad. Wait a minute. And my dad is going to get my pain medicine right now. So, and it hurts to talk because on my right side, they went in through the jugular vein, which is like in your neck. So it's kind of hard to talk. And that's where they thread the catheter through. So it's hurting. It's not very bad pain. I mean, I'm in pain every day, so, you know, it's just a little extra added bonus pain. So I got my prescription. I don't even know what it is, but I'm definitely going to take it because I am hurting pretty bad. So I got hydrocodone. The usual, take 1 to 2 tablets by mouth every 4 hours. So I will definitely be doing that. Yep. I'll definitely be doing that, but like I said, I'll show you guys my incisions and my port and everything later. And I'll do a video on it. After I eat something, because I haven't ate since 9 p.m. yesterday, and right now it's like 5 o'clock the next day, p.m. So I haven't almost eaten in like almost 24 hours, so I'm about to try to eat something, but my jugular vein hurts so bad. I don't know, but I'm about to try to eat something and then call it a day. And then hopefully later on, I won't be as hurting as bad, so I can show you guys the port and talk a little bit more about it. So yeah, that's all. I'm just gonna wait here with my ice pack. See y'all later. I'm gonna show you guys. I just got done eating something so I can take a pain pill because I do want to get some rest. So I would say, okay, so if you're a person that is used to chronic pain and used to like you know, having procedures and surgeries done, I would say that the pain level is probably about a 4 right now. For those of you who aren't used to it and do not have a high tolerance of pain, you'll probably rate this probably about a 7 or 8. Between a 7 and 8. So it's not that bad. So I'm gonna go ahead and show you guys. Okay. So basically, so what happened was the ideal side to use is your left side, and I'm as numb as I don't know what. So they're supposed to go through the left side because it's closest to your heart, which is where the catheter connects to. So they tried to go thread the catheter through here, and then the port would have been placed right here. But my veins are terrible right there, so they couldn't use that side. So to the right side, they went in right here with the catheter, which is like a fake vein. So they put a fake vein in, and they bring it down to connect to the port, which is about this big. Let me show you a picture. Let me get a picture because they gave me a thing. I have a single lumen port. So this is a picture of the port. It's the top picture right there. So that is inside of me, and you see the cord right there connected. That's the catheter. So that's the catheter that's going through here all the way connecting to that device. So that device is actually right here. And I was pretty like scared about this because I thought it'd be sticking out. I've seen so many people's surgeries or whatever where their catheter, like you can actually see it through their skin, but you absolutely don't see it. You can see the catheter a little bit, but I don't know if that's because I'm swollen, but I think it looks pretty good. So this would be used for blood draws, for my infusions, and what have you. So that is what it's looking like just a few hours after surgery, and that's it. Anything you want to say, Mom, that the doctor told you guys? Mom, you're already on the video. Anything you want to say?
I thank God it went through great.
What else? What else? That the doctor told you?
Oh, that in 24 hours you can shower.
Okay.
And you don't rubber scrub that area.
Why?
Because he actually used the glue.
Okay. So I don't have any stitches.
No stitches.
Oh, that's good. Okay.
Okay.
What else? What else? That's all he said?
Yeah, we'll go back to see him within a week.
Okay.
But it's actually ready to be used.
Good. So yeah, that's pretty much it. That is, like I said, just a few hours after I had it done. You can see I'm up in the, well, not really up and down, a little bit, talking and stuff, but it does hurt to turn my neck, you know, a little bit in certain positions and angles, but it'll be alright. So hopefully that, it's not too much of a pain. I do have little sharp pains when I turn my neck because I forget, but hopefully that'll go away in the next 2 days. So I will vlog the next few days because a lot of people usually have questions about ports, I've noticed from watching other videos and reading other people's vlogs. So I will continue to vlog the next few days of this recovery. Alright, that's it. I just woke up from my nap. It's about 7:48 p.m. and I woke up. I slept good. I woke up because I was in my right side was hurting a little bit. absolutely woke me up. So I have to get my mom to help me up and redo my ice pack. But I guess you could say now that some of the medicine have worn off, I'm probably at like a 6 as far as pain level. But this side is still pretty numb. I have absolutely no pain on this side. I'm not sure if that's from the from the local anesthesia that they put on here and the numbing lidocaine that they use on this side. I'm not sure if it's because of that or because, it's actually nothing, in me versus the port being on my right side. But my neck is still absolutely... There we go. Zoom in a little bit. This is probably the sorest part. It's the smallest incision, but it's probably like the sorest part. As you can see, when I pull the skin a little bit, you can see a line right here. That's the catheter. And there's where the port is. It looks really good considering some people's port. You can actually see and it sticks out. But hopefully that'll heal pretty good. So I'm about to get some more ice I can put on here. And probably try to use something else. Okay. That's about it for now. So I just woke up. It's the next day. One day post after my surgery. So basically, I did wake up a few times throughout the night. I mean, that's really nothing new, but it was the pain from the procedure that was waking me up. It was just really sore. So in the middle of maybe around 2 a.m. this morning, I was sore and nauseous. And nausea was probably, that's nothing new either, but I was probably really nauseous because of the anesthesia. And so I woke up around 2 something. My mom helped me to get some tea. So I made some hot peppermint and ginger tea with some lemon in it. And then I sucked on, some of the lemon. That really helps with my nausea. So I did that. Got another ice pack because it had just turned into water. So I got more ice. Well, my mom got more ice for me. And so I laid back down. I took it back to the room, laid back down after I drank the tea, put the ice on there again, fell back asleep. Didn't wake up till 6 o'clock this morning for a second. We were supposed to go to Tennessee to see my oncologist, but we didn't go. We rescheduled it for next week, Friday, because we're going to be there anyway, because I start my first infusion on Thursday. So it's almost no point of going, twice. And then with me being nauseous last night and really sore, we didn't want to really risk it on the road. So we didn't. So, like I said, I just fully woke up. I might try to eat something. I don't want to get nauseous again. But I might try to eat something. And my dad is calling. What's I'm going to do? My dad is calling my surgeon because they forgot to ask about my port kit and my numbing cream. So, yeah, they forgot to ask about that. They had it written down and everything, and it was 2 of them and not 1, and they forgot to ask. But I don't blame them because, after the doctor comes out and tells you, a whole bunch of other stuff, like, oh, we tried to go in this way, her veins wasn't good on that side, we wouldn't expected all that. So, they forgot to ask. So my dad is about to call my surgeon right now and ask for that stuff, ask for that prescription so I can pick it up, so I can be ready for Thursday. And pain level, I'm gonna tell y'all, I have pain every day. I have aches every day. I have stiffness. Excuse me. I have stiffness every day. Every morning for about 3 hours, I can't close my hands, make a fist, because my hands are so stiff. So to be honest, you know, if you was in my situation, you wouldn't be in pain. Like, this is just a normal to hurt, you know? So, you know, if you just have a high threshold and you don't hurt every day, I would say the pain level is probably, you know, let's see, maybe like a, I can't even make it up because I have a high tolerance. So I'm gonna say for me, my pain level is probably about a 3. Yes, yesterday I did take a pain pill because I did want only one though of Norco, you know, hydrocodone. That doesn't work for my daily pain, so I didn't really expect for it to help too much for a surgical pain. But I did take one so that if it did decide to help some, that it'll let me at least get some rest. And I'm not sure if it's the anesthesia that has helped me rest along with the Norco, but I did get a lot of rest yesterday. So I was thankful for that. I only took one pain pill, and I probably won't take any more. Not sure yet, depending on how today goes. But it's honestly, it's just really sore and tender. It's not really like a pain. I'm gonna zoom in one more time. So that's where they went through my neck to thread the catheter, which is like an IV line that the fluid runs through. And so they threaded to connect one end right here. The port is underneath my skin. As you can see, guys, this looks great. A lot of people, some people's ports like stick out of their skin. You can't even tell that mine is there once this heals up. And he didn't have to use any stitches or staples. He only had to use the surgical glue. So once that other end of the catheter connects there, it's another end that goes across to your heart through the vein. The goal was to use this left side because it's closer and you don't have to use so much tubing. But you know, that didn't, like I said, that didn't work out. So they had to use, of course, way more tubing to get it to my heart on my left side. So yeah, that's pretty much it. That's what it looks like today. Looking good. Pretty much looked like yesterday. So yeah, that's it. So I will probably check in a little bit later, and yes, I'm in my same clothes still from yesterday. And it's because you cannot shower for 24 hours. And I just hate to put on clean clothes and not have showered. It's kind of like when you go to the swimming pool and you go swimming and you throw back on clothes, clean clothes. It just don't feel right. So that's kind of like how I feel right now. So I'm not going to waste any clean clothes or whatever. I'm just going to wait. I get about 5 more hours so I can shower. So I'm going to take a good shower. Have to be really careful with this area. I'm not to actually wash over it or anything. I can't let water drip down, but I'm not allowed to soak it. So if I took a bath, I have to soak in the tub. You know, I kind of do that often anyway with my Epsom salt. If I have to soak in the tub, I can't submerge. So that's about it. So yeah, I will check in later, let you guys know how I'm feeling, and give an update.
Alright. You recording again? Okay. Oh, I got you all the cards.
Yeah, the new insurance
The
card.
new?
The both of them. I'm gonna take my blood pressure line. Mama gave it to you.
You know I forget, man.
Okay, I'm gonna take my blood pressure. Somebody has good blood pressure. whoever was here before. So let's see. I know that I usually have good blood pressure. Uh-oh. God, this hurts. I think everything is like sore right now.
Ma'am? Yes, ma'am. Rhonda on accident. So I guess I need to give y'all these insurance cards. This new insurance card. Yes, ma'am.
Alrighty.
Yes, ma'am.
It's just taking a while.
And then see what they say and put this as the secondary. Because I know the Cigna is forcing people. I'm sorry.
The secondary right there.
This one is secondary. Okay. That'll be good because they're not covering any prescriptions over CVS anymore.
They not what? Do I need to go to Rite Aid then?
They're saying they're forcing y'all to Rite Aid, Kroger, or mail order now.
Oh my goodness. Okay.
For any consult hospital health system.
Okay.
Good blood pressure, but my pulse rate is, that's not really high. Really, it's been like 125. So what happened, Dad? What happened?
Okay. They saying the segment uncovered. They're not covered in the secondary or something like that.
Why?
So we'll sit. Let's sit down. I'm tired.
Okay.
Oh, what's up? 117.66? That ain't bad.
No, I have good blood
Yeah,
pressure.
look at you. See how mine is.
Okay. You gotta erase it.
Squeeze me to death. Where's erase?
The red button. Now you put your arm in.
That ain't right. That ain't right. What, right there?
Uh-huh. Then you press, wait, make sure it's not on your elbow.
Huh? No, it ain't on my
Okay, now press start. It takes a little while. Dramatic. So, Cigna's not covering any medication?
Well, I had to get a better understanding when I go back up there. To get a better understanding of it.
Wait, Dad, it's gonna do it. Takes a long time.
For this?
Yeah, I was sitting here for like 3 minutes. Okay, not 3 minutes, about a minute and a half. So do they at least have all my stuff or no? Do they have all my stuff? They have all my stuff, right?
I'm thinking they do. It's the matter of
But your
Cigna.
insurance do.
yeah, my insurance, but I'm not sure if they cover the other 20%. Though might be 80%. Because they said if Sigma not covering Kroger's and 99 by 66.
What type of blood pressure you got? Something wrong with you.
It might be too.
That's too low.
I think it's too low. Yeah.
You need help.
Hey!
Salt.
Don't say it like that. Then somebody help.
That's too low. Mine is low, but that's too low. 86 is your pulse. Oh wait, hold on. So, Mom, what you about to do?
Take the bandage off if we can get a grip on it.
So these are from when they tried to go in the left side. The side's really supposed to go in. Oh God. Nurse Gwen. Nurse Mom. What does it look like? What is that?
Just like a little
Oh, it's a little
prick,
hole. Okay.
like they stick you for an IV.
I can work with that. This one's kind of tender. But go ahead. So I just took a bath, finally.
It's been 24 hours.
After 24, yep.
Sorry. Evidently not wet enough.
Yes, it is. Oh boy. What if I just start gushing out?
You're not. It's like a pinprick.
Don't even see anything.
It's like a pinprick.
Oh, I see it. Good. Okay. That was easy. Alright. I'm about to eat now. Morning. So, it is Saturday. What's the day? When did I go? Thursday. 2 days after surgery. Still looks the same. It's looking good. I'm not swelling. I've been keeping my ice pack on it. So, just a tip. So, if you're having the port done, and depending on where he puts it, your surgeon puts, if it's closer to your clavicle, like up here, okay. But if it's lower, like where mine's is, like almost into the breast area, which is where they put it for, hopefully for most females, if the doctors think that way, so that we can wear bras and stuff, wear a bra. Because without one, it hurts, because I think it pulls it down and tugs on the, we don't have any support, it tugs on the scar. So, that's my tip that I've learned from experience. Wear a bra if you're a woman, especially if you're a woman with big boobs. I mean, it's bothering me and I hardly have much. So if you have like big breasts and you get a port put in, like, you know, lower down, then definitely wear a bra. Besides that, I woke up nauseated. I had some lemons and some ginger and peppermint tea this morning. And that is about it today so far. I am going to try to go to church. I'm going to be my most comfortable for church. I know that. I'm not wearing nothing fancy to church. They say come as you are. So that's how I'm going to come. So yeah, that's about it. Okay, so it is Sunday. I did not do any recording yesterday, Saturday, but I'll tell you how my day went. Just really tender. I did actually go to church, but it was horrible. I felt so terrible. And by the way, I just woke up and it's 2 p.m. That's why I look like this. But yesterday I did actually go to church, and as soon as I got home, I knocked out for like 3 hours. So today I just woke up and it's 2 p.m. Like on the dot. Like I was knocked out and I went to sleep at like 11:30. I woke up one time to go to the bathroom. So I've been getting so much needed rest. I guess making up for the time that I probably shouldn't have when I was in church. But the reason why I didn't record any yesterday is because I was hurting so bad. Like I knew that when I did the surgery that it was possible that I go into a flare, meaning, you know, I would probably swell more or hurt more or whatever. And I did. I started swelling up in church. I don't know if it was cold or from the surgery, but the thing is, I was already having these sharp pains in my knees, so I knew it was coming. So I had to walk out of church. The cold makes it worse when I flare, especially the pain. So I had to walk out of church and go stand outside and sit in the car or whatever until church was over. But yeah, that was pretty much it for yesterday. But my hands swelled more yesterday. My knees, oh my god, they was hurting so bad, and they was swelling up so bad. My ankles, my feet was on fire. I mean, these are everyday things, but they happen anyway. But you know, it was an increased pain and increased swelling, so it was way worse than the normal everyday swelling that we're having. So yeah, just wanted to check in on that. Like I said, I just woke up. I don't know what I'm about to do. I can't really see my pain level. Yesterday, very painful, not specifically the site of my port, but I did make sure I iced it at least twice yesterday. I woke up, I had an ice pack on me like all night. I wasn't doing nothing all night, but let's see. There is the site. Looking good. Looking good, so yeah. It's not that tender right now. Not sure when I sit up what's gonna happen. My hands are a little swollen today. Like every morning when I just wake up, I can't move, like literally get out the bed yet. My body doesn't work. It takes me about an hour, depending on the day, maybe longer, to be able to get out the bed. So like right now, I can't make a fist. Anyway, so I can't grasp anything or do anything. Like I can't brush my teeth like this. In the bathroom. This is Monday. So a few days after surgery. To be honest, my pain level as far as this isn't, you know, bad at all. It's just really, at first it was real tender to touch, to move, and I had pain in the port site area. I don't know what it's from, but I guess just from like certain movements, but certain movements do hurt. I can't lay on it yet, like lay on my stomach, and that's how I get my best sleep. So, yeah, I'm just gonna have to deal with that. So I've just been laying on my left side lately, but now I can actually put some touch on it. Before it hurt to pretty much touch it, but I'm just touching around it. I don't want to touch on the scar site because I don't want any infection. Even though it's a dermabond over it, you know, I still don't want to touch that area. And then up here, you guys can see the tubing and where they went in right there. So everything's good on the healing process. So this is probably the last of my vlog for my port, but I'll talk about it more. I'll talk about more what it is. I'll do a video on that. So thank you guys for following my journey.